Yeah, so we've actually had some discussions with different employer platforms that are predominantly focused on wellness, and they're predominantly focused on presenteeism and work performance. And many of them are looking to do partnerships with companies like ours because they're starting to get asked about chronic disease, because their offerings don't get that deep beyond the step counts and the challenges, which are very important, right? The wellness part of it, getting proactive, being preventative is an important part, but they're starting to want to close the loop. And that's because a lot of employers are either creating on-site clinics or contracting directly with new types of providers, cutting out the insurance middleman for primary care. So they're starting to want to connect their wellness platforms with actual disease management and more medical platforms. So it's an open opportunity for companies like ours.
But I would just add, I think ultimately you have to prove that whatever you're doing pays for itself and that it's worth whatever the cost is. I mean, none of this can be free. So, do the benefits outweigh the costs? And no one knows the answer to that yet.
So ours is a cloud solution. We have architected the solution from ground up to be the data is partitioned off in ways that putting that puzzle together as to whose data this is, to be able to construct a health picture that is also associated with the personally identifiable information is rather difficult. So this whole notion about can someone hack in and reconstruct and what can they find out that would be sensitive and should be protected is built into the architecture. Legitimate concern, but we are thinking about it every day. I mean, from whether it's password changes to just keeping data just so spread out that you really just wouldn't know how to piece it all together. Those are all techniques we're using.
Every one of us in all of our contracts has to adhere to our HIPAA policies and procedures, and you have to sign a BAA with every contract that you do. So it's just part of the business, but shouldn't be seen as an insurmountable or egregious need. It's very doable to go above and beyond HIPAA standards and really be focused on data privacy and not have it bankrupt your company. So don't let it hold you back, but make it a priority.
Great. Just part of the business, and one of the first things we do when we start a pilot in a place is talk to the IT team. They have questions, we give them the answers they want, they clear us. They usually want to know, are we compatible and secure, and do they have to do anything before starting a pilot? Because we can tie into an EMR, and usually at the beginning they don't want that, because that's work for them. So once they hear that we don't need to and that everything's secure, they're happy and they sign off.